personally led you to explore frequency-based healing as a legitimate complement to medicine?
The advancement of technology, the scientific experiments and the research and the improvement in the skill and expertise and experiences. Why does the pain arise in the first place? What does the body wants to tell?
Because the body remembers everything, it has cellular memory. How would you explain what is quantum frequency therapy?
Whatever is in this world is not the matter. Matter is even 0.0001% of the whole universe. And the matter is coming from that energy. Mass is a condensed form of energy. Replenish the chemicals in the mass or transplant the mass, remove the mass. We are working on all these arts.
Atma Namaste. Welcome to the podcast Align, Attract, Achieve. I'm your host Avrril Quadros, the life architect. And this podcast is called Align, Attract, Achieve because everything begins with alignment. And after that, you attract seamlessly, effortlessly what it is you wish to achieve in your life. On this podcast, it's my aim to introduce you to guests who have wisdom, experience, and a passion to teach without expectation from their audience. And today, it's my pleasure to start this podcast series with Dr. P.K. Jha. Today's guest is someone who stands at the rare intersection of cutting-edge medical science and visionary healing. I am honored to welcome Dr. P.K. Jha, distinguished neurosurgeon with over 23 years of experience, trained at the prestigious AIIMS, New Delhi. He brings deep expertise in brain, spine, and nerve surgery and is widely respected for his pioneering work in brain mapping, spine surgery, and a revolutionary concept that he champions, thought medicine. Armed with various degrees, MBBS, MS, MNAMS. Dr. Jha currently practices at Neurocare India, his brainchild, where he blends evidence-based neurosurgery with a deeper understanding of how consciousness, mindset, and neuroplasticity influence healing. He is also the founder of the Healthy Happy Life Foundation, a platform that reflects his commitment to holistic well-being. What makes Dr. Jha's journey even more remarkable is that beyond the operating room, he is a certified life coach like me, dedicated to helping people heal not just physically, but emotionally, energetically, and spiritually. As the founder of Neurocare India, he is pioneering an integrative healing movement that bridges the gap between modern neuroscience and the subtle realms of energy and consciousness. Get ready for a conversation that will expand your mind and challenge your conventional ideas about healing, health, and the human potential. Enjoy. Align, Attract, Achieve. Dr. Jha, as someone trained at AIIMS with decades of experience in conventional neurosurgery, what personally led you to explore frequency-based healing as a legitimate complement to medicine?
Well, see, we are literally doing miracles with the patients now. With the advancement of technology, the scientific experiments and the research and the improvement in the skill and expertise and experiences. All this is happening. We are getting good result. But when the same patient's relative come to you that, Dr. Sir, I've heard your name, you have healed him, you have removed the tumor and you have treated the spine. I have this pain and please heal me. Now, if investigate that patient and the patient doesn't have any problem which requires surgery, then actually it becomes difficult for us to meet their expectation because I have nothing to offer from the point of view of surgery. And 1 out of 100 patients of headache or back pain might require surgery. What about that 99% of patients? So in them, you can either give medicine, and everybody is giving. Medicine can only suppress the pain. जिसको हिंदी में बोलते हैं दवा जो है दबा देती है. So if you just suppress it, and that is the cause of biggest, you see, there will be temporary relief that you don't know. In the long run, that is going to cause big harm, not in terms of the side effect of the medicine. What harm is that body wants to tell about it. That is, the pain is the only language of the body that wants to speak to you. If you just suppress that with medicine, कि चुप हो जाओ, तंग मत करो, सो जाओ, numb it with the pain medicine. That's what doctors can do. And then the same problem reflects on your life later stage in a big form disease like heart disease, like cancer, like stroke. These are only the result of suppression of pain because of analgesics. You didn't address the root cause. So I was concerned about the root cause since quite a long time. Why does the pain arise in the first place? What does the body wants to tell? Why a person who is normally healthy has some pain chemicals inside which is so toxic, and we just numb it with medicine? Why can't we stop the production of that chemical that is causing the pain at the first place? Because all the pain chemicals are just antagonizing the effect of the pain chemicals wherever there is a site. So this therapy, the frequency therapy, or any other therapy that leads to emotional and psychological nullification and making the patient in contact with their emotions and reality of life, then those pain chemicals begins to decrease. And the frequency therapy helps in doing that, not only in reducing the pain chemical formation, but also giving that frequency on which that pain chemicals does not work. So this therapy, and I was doing many other methods also, which was giving effect, but this frequency is measurable and its effect can be seen, can be measured again. That's what.
Thank you so much for saying very acutely that it is measurable. And the other thing which you mentioned is, I would like to paraphrase, like in healing, we say the body keeps score. Because the body remembers everything. It has cellular memory. So I think a lot of us, we don't realize that with an analgesic or with, whatever, paracetamol or whatever it is, could be even a cancer drug or any kind of drug. Yes, we will get relief. No one is denying that. But I think it's masking the root problem. So it leads me to my second question. Most of the people, of course, doctors will understand differently and lay people like myself will understand differently. So for the 90% people out there who are just lay people, even doctors to a certain extent who understand medical science but not frequency, how would you explain what is quantum frequency therapy?
See, the quantum frequency effect is measurable, and the research are going on. Whatever is in this world is not the matter. Matter is even 0.0001% of the whole universe. Whatever is not matter, and that is unseen. And that unseen, that energy is defining the matter. And the matter is coming from that energy. Mass is a condensed form of energy only. Ultimately, what is seen, but beyond that, what is seen is energy. And if we just manage that energy, which is leading to that mass, we can change the mass. So in medical science, we are only concerned with the mass, which is called Newtonian physics. Newton gave mass, momentum, force. That is only what is seen. But Einstein gave us energy. That leads to the mass production. So they say the energy and mass can be interconvertible. And we are not yet utilizing that energy factor in the mass. So in medicine, we only replace the mass, repair the mass, restore the mass, replenish the chemicals in the mass, or transplant the mass, remove the mass. We are working on all these arts. But we are not replacing the energy that is lacking, that is causing change in the mass. And frequency therapy defines the mass, rather redefines the mass. So it leads to complete different mode of action, which the medical students are not taught yet. And I'm sure in coming years with the research that I'm doing on frequency therapy, this must be included in the mainstream medicine because patients do have the right to get completely healed, not only masking of the symptoms.
Thank you for saying that because you're right. Every person deserves to be healed, not just masking of the symptoms. So thank you again for, straddling both sides of the fence the way you're doing with modern medicine, which is very important, but also understanding that there is a root cause for everything. And to address the root cause, frequency is the key. So I'm going to ask you my next question. So modern medicine often treats symptoms rather than the root cause. So in your view, how does frequency therapy shift the focus from suppression to systemic recalibration, especially in this world which is very stress related, and we have very chronic conditions. So, chronic diseases, how do we get that paradigm shift? How can functional medicine give us that paradigm shift?
See, what this thing is, the frequency therapy is measurable in the sense that even in medical science, we use psychology. We use psychologists and therapists and counselors in our ward. They are there. Nobody is denying that, and nobody is contradicting that, because patients do get benefit. This frequency therapy is the same thing being done without a man. The machine is doing it. The same frequency that a healer is giving is now being given by the machine. And somebody may not believe how can a machine can work as a human, because human give love, that kindness, that this thing. But the same frequency can be now measured, and its effect on the cell and the mitochondria and the ATP production, cellular regeneration, all are being researched in a high speed now. What is the effect of frequency on cell and everything is being measured, and it is almost the same. So you give love, you help, you kindness, you compassion. All this is energy only. Only healing or this energy differs in that the same frequency can now be given by the machine. That is the radical shift that has occurred, and we must do research on this and prove or disprove it. That is, it is open way. I'm not favoring or contradicting both. I'm just using so that I can do research. How does it affect? We have no option. There is no option of medicine. If you cannot do surgery, you can give only medicine. You have not got anything. But suppose in case of migraine, you are giving painkillers, some gabapentin, some pain, whatever chemical you are giving, just numb the pain. It does not go to the root cause where from the pain is arising. But in migraine, if I give 2 or 3 sessions of frequency therapy, patients are benefited like so. Where from the pain was coming, where it has gone. So the effect is palpable, is measurable, and hence we must pursue its use and do the research on this.
Thank you, doctor. So like you said, when people go to a healer, like even there are many doctors who go to a Reiki healer or to a pranic healer or a somatic therapist, and all these like somatic therapy, psychology, psychiatry, CBT, these are all recognized, arms of medical science. They're not counted in the healing science or occult sciences. They are mainstream medical science, and all of them have their basis in frequency. Am I right?
Yeah.
So if all of them have their basis in frequency, why do you think people have, a bias towards a quantum frequency machine, like the one I'm wearing, like Healy? Mm-hmm. Is it because it's a machine and it doesn't have the human element? Because only the human element, like you said, in terms of nurturing, like a hand holding or, talking to the patient, only that is missing. But I would like to say, being a Healy user for almost 2 years, Healy can also give me emotional balance.
Yes.
So that I don't think, from my own perspective as a user, as a lay person, I don't think there's anything missing. Is that fair to say?
See, the thing is, the importance is to understand how that energy affects the mass, because a lot of places, big research is going on mass consciousness interaction, and for people who can understand quantum physics, the Healy, this device, releases scalar waves. Yes. A scalar wave is that energy which doesn't have any momentum, any direction or force which is measurable. It is just scalar, means it spreads in all directions. Yes. It reaches to the whole part of the universe. So it affects the mass from this frequency, and the mass changes in shape, in size, in orientation, and the main reason for that change in the mass is the water. Everything is water, and the water is a dipole, and dipole is loosely connected through hydrogen bonds, and it is experimented that by giving energy in different direction and different amount, the water reorganizes itself in different direction. Yes. And it is the microtubules in the cell, those who have water, and the microtubules arrange itself in a direction from whole body that is causing nadis and channels that we describe in Hindu philosophy. That is actually the reoriented water molecules inside the microtubules of the cell that causes the alignment of the microtubule and causes nadis and all, and energy flows in that direction. So once you have energy and your 70% of body is water, and you are aligning those water, making them more productive in metabolism, in doing every activity that water can does best, is affected by this frequency. And this research is being done, and it has given miraculous result in suppose some person like animals and plants are better affected by healing. You must have experimented. Many people say that the animals or plants are affected like anything more than the human. Why? Because they are quite sensitive to energy. Do not have mind like a human being, and the mind is a contradictory factor in man that makes healing difficult. And because it is so many contradictory waves that even the scalar waves are confused. So healing is only effective in those persons who have faith that I will be healed. I allow healing to occur to me. Those who will question this, that how it can happen, this is a rubbish, they are not affected by healing. Because that mind waves affected their water molecules, and they are not reshaped in the way that animals and plants can do. So that is belief factor again becomes important here.
You said something very astute, which I remember Dr. Joe Dispenza saying. He says the observer makes a difference.
That's what.
Yeah, so if the observer has a negative bias, you will get negativity. It is law of attraction, like attracts like.
Yeah, that's what. The quantum is what? Anything is either mass or energy.
Yes.
It's never, means anything, any observation is either mass or energy, depends on the observer that what he thinks it to be. And then the reality shapes itself from the observer's point of view. And that is the difference. So belief is important again. If the belief is there, that same mass will be energy, not the mass. For other, it will be mass, but for other, it will be energy. And energy can be easily manipulated through our emotions and thoughts.
And also water has intelligence, right? Dr. Imato had done these experiments. And so the reason I'm saying this before we started recording this formally, I told you about my pet who has an enlarged heart. And they told me I'll have to put her on medication for the rest of her life. And she's very small. She's a mini Yorkie. And then when I spoke to a time waiver therapist, she said, but we can give Tara programs on Mag Healy. And she's so intelligent. Animals are so intelligent because even though the program says 36 minutes, she will take only the frequency she wants to take. Then she will just get up and she will walk away. And because she is not questioning it, and because she's in touch with her energy, I have seen a miraculous recovery in her. Like she runs around, she plays, nobody will tell that she has an enlarged heart. And the plants in my house, I energize the water with the plant program on Mag Healy, and I water the plants. And sometimes the plants which are dying, when you talk to them and when you put this water, they actually start growing again.
Yes.
Because there's no negative bias.
There is no negative bias in plants and animals because they do not have the mind, human mind.
Yeah,
human mind has become our enemy. Yes.
Yeah. So the modern mind has become our enemy, right? Because we are always trying to think with a negative bias. We all have a stronger negative bias than a positive bias.
Yes. Today's world has become the preference is to say no because many things are fake,
Yes.
and the default tendency is to say no. So it is very difficult to accept anything which is new because so many things are coming in the world in this in social media that this. So people who do not know will always question it, and they must need the broad means that solid background to understand and accept this therapy.
Yeah, I think it comes from a protection mechanism, right? They don't want to be
Yes.
scammed. They don't want to, make a mistake. So the first
Yes.
thing is as a defense mechanism, they just say no. But I think keeping an open mind is also something on the opposite side, which needs to be used astutely.
Only thing is, what is the other option as a doctor if you are healing one person with a chronic disease that do not have medicine? You can only give steroids. You can only give analgesics or some sulfasalazine for chronic arthritis. Patients are still in suffering. They do not have any hope of cure. But why not to add this? I'm not saying this can stop medicine. Medicine, the allopathy or modern medicine was made for the purpose of two things only. Just to stop death, save limb and life. If somebody is dying, I will not use frequency therapy. I'm a neurosurgeon. I remove clots. I have some brain rupture has happened. Some spine has broken. I have to attach that. So medicine and doctors are still required. It's not that this will be a replacement ever. But the person who is having intense suffering and the pain, both physical and mental agony, you cannot just suppress it and numb it with medicine. There must be some solution. And this is a solution that has come up. And if a person who takes this therapy with open heart and open mind, with full confidence in the doctor who is giving it, the therapy leads to miracles, I've seen.
Thank you, doctor. Yes, I think both you and I have seen miracles, and that's why we're doing this podcast. So,
Yes.
neuroplasticity is a buzzword. Everybody's talking about neuroplasticity. The Hajar podcasts have done neuroplasticity, but there are very few interventions that actively support it. So, do you believe that frequency therapy through Healy can enhance neural rewiring in a measurable way? And if so, how?
See, the Healy, it is called causes alignment of the cell with the cosmic flow. Means it is called cellular harmony is the common buzzword in quantum physics. We are doing cellular harmony. What is harmony? The harmony is your inner vibration, your own body's vibration is in harmony with the cosmic vibration, and you are in alignment with that. Your mind is one factor which comes in between your body and your cosmic vibration, and it makes a shield around you. So you are living on your own concept and energy. We are detached from the energy which has made you in the first place. And this Healy gives that harmonization. It not only gives the energy to you, it also gives the scalar wave in your energy, in your aura, on your body, and detects the coherence factor. What is the energy I'm getting back after giving this scalar wave frequency? And then it does a diagnosis also. What is coming back from the source? And from that energy which is coming back, there is a lot of AI-based analysis from the source. Okay, how is the source? It gives the diagnosis also. Okay, this is the energy coming back from us, and from the analysis of crores of data, this is the final picture in one person. And this is the energy that has to be given to replenish that energy which is lacking there. So it is not only giving the energy, it is also diagnosing and getting the real frequency lack that a person has, so that it makes them into coherence with that cosmic energy. And once the cell comes into coherence, which your mind was not letting it to, the cell begins to function in the normal way. It is measured that the cellular depolarization potential, which is called cellular resting potential. A normal cell has the inner membrane at minus 70 millivolt. This is normal cell's inner potential electrical energy. But a sick cell reduced to minus 50, a cancer cell reduced to minus 30. This has all been measured. What is the resting potential of different cells? A healthy cell has minus 70 to minus 90 also. So it becomes easy for them to activate and to respond to neural stimuli. Neuroplasticity is letting the nerve cell function in the normal chemical environment. And then when the surrounding, the energy vibration is okay for the nerve cell, it will grow, it will reconnect to the nerves which is required, and it will develop the inner organelles inside the cell to release and form the chemicals that is bound to do, and it will function normally for the function that has been assigned to. That is called neuroplasticity. Either the number of neurons will increase, or the same neuron will become more functional, more optimal. And this Healy frequency causes that coherence for the cells to function in a normal way with normal depolarization or resting potential that is bound, that is made for to function.
Thank you, doctor. So if I were to ask you just in a simple way, because people who I talk to as a healer, as a coach, as a therapist, they say, how will Healy heal me? I don't think Healy is healing you. Can you explain to people exactly in just 30 seconds what exactly is Healy doing? Because I understand what you're saying. Healy is bringing the cell into the minus 70 to minus 90 millivolts. Mm-hmm. You can just explain to the lay person in simple language, what exactly does this quantum
in one sentence, I'd say this: Healy produces the environment around your body that lets the system heal. Your body always wants to heal, always tends to heal. You do not let it heal. Your mind does not let it heal. Healy will let it heal, because it will give you the vibration, the surrounding that will not be harmful for the chemical, for the cells. The cell always move in the direction of complete healing and repair. That is a default mode of the body. Children having some injury, the repair occurs within few days. and much more quickly than the adult, because adult have that resistance of healing has come down. The stem cells, the cells which is pluripotent, can grow in any direction, are much more in number in children. And with our thought only, with our inner pollution that we create from our mind, rage, fear, anger, apprehension, worry, all these chemicals causes death of those pluripotent stem cell that causes repair and healing. And your chemical environment also changes. So healing not changes your cell, it changes the environment in which cell function, and it lets you heal. Your mind does the opposite. So
Yes.
it is a contradiction to your mind. That's what it is.
Yeah, thank you, doctor. That was beautifully put. So, we all have critics. And so there are many critics around who say that frequency healing is a pseudoscience. As a scientist and a surgeon, how do you distinguish between unsupported claims and emerging paradigm shifting tools backed by subtle evidence?
See, the thing is, yes, of course, wherever I go, I also talk about this because I've seen the effects on my patients. Many say, also, where is controlled trials? Where is a double-blind trial? But first, the medical fraternity has to apply this in the study. Means if they reject it at the first place, how can do the study? This is not causing any harm. Although you are giving medicine only, so you can do your controlled trial. You take one machine and take 10 patients of some disease which is not curable by medicine, just suppression of pain is possible, and give healing and give medicine and see the result in 3 months. The difference will be there. At one place, means there will be side effect of medicine, there will be temporary relief of pain, there will be no cure, but healing will reduce the dose of the medicine and will lead to significant reduction and permanent reduction of not only physical pain, but also the emotional pain and psychological harmony. So if we can just go with this open mind, let us do research.
Yeah.
Then we can make difference and then can bring this heavily in the mainstream medical science.
Thank you, doctor. Doctor, you're doing similar work like this, which I want to ask you about in Neurocare India, because I've gone through your amazing website. I have seen testimonials of people. And so you are a path breaker because you are actually conducting these trials, and you've invited even people like myself to be part of it as healers and coaches, because I know for a fact that when I give people distant healing, they never stop the healing till they have the funds to buy the healing. The only reason they continue healing for 6-7 months is because they don't have the finance. The moment they get the finance, they buy the healing. So I've seen that even with distant healing, people's mental health improves by more than 60 to 70% in just 3 to 6 months. And I back everything up that I do with testimonials. But of course, if people were to believe me and you, they would rather believe you because you're a decorated surgeon. And that's why I think it's so important that we're having this conversation. So my next question is talking about distant healing. So how do you explain remote healing, non-local healing, distant healing from a quantum perspective to a doctor or to a patient who has never encountered this concept and who doesn't understand what is distant? If I'm sitting in Canada and you're in Bangalore, how can you send me healing?
Mm-hmm. See, the thing is, it is called intention field. If you're thinking about something, you are creating some worlds in the universal energy. And the first thing that healing does, it registers the information field of a person. And how does it do so? Suppose I'm registering one person in front of me. I tell him to just think about himself and the best that he has, that my whole personality is stable and strong. Think about yourself in great means, complete focus yourself on what you are. And also the observer, as I tell you, observer also observes that person very intensely, that this is the only person that is in front of me, is of importance. May his life's energy be completely modified, he be healed. So I'm intensely focusing on that person. And that intention field around him and me and my energy going to him and thinking about him, this creates an information field in the universe. And this is measurable by quantum physics. So those who doubt quantum, this healing has to understand that this intention field is measurable. And Marcus, who developed this software, the formula to measure that intention field was given to him by the great scientific scientist of quantum physics in 1990s. So he used that formula to measure any information or intention field. So if I think about you, and exactly you will be registered on the server of Healy, wherever it is, and later on it will connect to your information field wherever you are, because it is called in Sanskrit Brahm. Yes. Brahm is beyond time and space. So the distance you call, if in Canada you are here, so there is no talk of distance and time in quantum field. Quantum field is Brahm, which is always is, was, and will be. So Trikal Darshi, we say about Aaj, Kal, so this is actual. The time and space we are born with, we have grown to such a stage with such an perspective of space and time that we do not think anything is possible beyond that. But this quantum field is beyond time and beyond space. It is ever. It was, is, and will be. So that quantum field is connected. Just you think about it, wherever you are. Just for one example, suppose my son is in America, US. If I just want to give him wish or blessing, I literally give it and he can feel it. So there is no distance in there. The same thing is happening with the Healy. It's just think about it and you'll be reaching that information field wherever it is in the universe. So just people say it requires internet. So internet is required, but the Healy waves goes without internet also. I'll tell you how I have experimented this. Even if I'm not in Wi-Fi or internet, how I can connect to that person. I was sitting in aeroplane where all internet is gone. There's nothing is there, but I could check the aura of my son down on the earth. I was giving the digital vibration, it was going because it does not require Wi-Fi. It does not require internet. If the scalar wave goes without any medium, so there is no medium required for Healy waves to go. It is only the Brahm which is everywhere. That is what scalar wave is. It reaches anywhere and everywhere immediately. So Brahm is everything is one, and everything what is seen is a different manifestation of the Brahm that depends on what you observer see this as. If my eye is different, I will see it differently. Your eyes is different, you'll see it differently. So the Brahm manifests into different reality, which is seen by different people as different things. So they are confused in this. So one time answer is it is Brahm or quantum field, and the information field is the intention that Healy catches up and stores in the server forever, which can be connected to any time from anywhere, and it can be analyzed, and the emotions and energy factor around it can be measured and shown to you. That is the miracle that is happening. And if you understand quantum physics, only then you will believe it. Otherwise, you will not believe it. Nobody will believe it.
And it's not very difficult to understand quantum physics. I mean, we're not asking people to go into the length and breadth of it. We're just asking people to understand the concept. Just to understand the concept.
One thing I'll also tell you, suppose one person, my friend was in US. I did his aura analysis. Immediately, I thought about him. I also told him, you think about yourself. I'm doing just send you a picture. I'm thinking about you. And it was registered on the server. He was in US. I registered him here. And the aura analysis and the emotional analysis that came surprised him. How it is so accurate. Yes, exactly. I am like this. How it knew about me. So this has happened not only once. It has happened hundreds of times. That I register person from anywhere and it tells about that person, and that person believes and says that yes, it is me, and how it knew about me. So it knew about you only because the information field was registered and it was analyzed, and frequency came to the server, and from the server it came to my mobile in the form of analyzed data based on AI analysis. That is the whole explanation. Now let people not believe it, but the effect is there, and only the effect will tell them that electricity is there. Nobody can see the electricity, but the light is there. So the effect must be proven rigorously, and then only people will believe it.
Yeah, it's the same thing with radio frequency, right? If you're trying to tune into FM, only if you tune into FM, you'll hear FM radio. Otherwise, you won't. So it's all about the right frequency. And like you said, intention matters. And this is what people like healers like myself understand, because we have been doing pranic healing and healing people in Canada, US, Iceland for many years before Healy. And now that Healy has come into, by God's grace, we have been blessed with Healy. Marcus, God bless him. It has made our aura analysis, are healing so much more efficient and time effective.
Yeah, pranic healing, as you practice, pranic healing is also doing miracles. One of the doctor in US, Eric Segel, he is a pranic
Yes,
healer.
yes.
And he has written in the book that even in ICU, the patient with tachycardia and shock, every medicine was tried, and he started doing pranic healing and calming, and his aura was completely analyzed and harmonized. His blood pressure and tachycardia, everything started to resolve it. So I'm not telling you why not to use it if it is effective in sick patient. And if medicine is failing, why not?
Exactly.
So it is the same thing as healing also.
Absolutely. I think everything could be done complementary to each other.
Yes,
You
yes.
can't take out one and replace it with the other, but if you don't give it a try, you won't know, right?
Yes.
So, if medicine of the future is, if we were to think medicine of the future is frequencies, it's integrative, how do you see the roles of conventional diagnosis and energetic tools like Healy? How can they complement each other, both for doctors and for patients? Especially people who are suffering from grave issues like, say, tumors, brains like strokes, Alzheimer's, those kind of things, which are, people say it's our last resort, or cancers.
See, one very bitter fact is there. Money is a great driver of decisions and future.
Yeah.
If one thing is told, that if doctor or medical professional or anyone is given such an amount of money that he doesn't require it anymore, will he do the same thing in the person? If the money will not be the factor, will his decision be the same that is now? If this question is answered, then they will get the right answer. And the government and we, the people, must combine that health should be given free to all. No earning or no expense from any pocket should be there. If that is so, then every person, there are 80 people in the society are sick, they will come to you. And you will confuse whom to treat. You will yourself say, bring something that will prevent the disease. A doctor is not thinking about the prevention. Let the patient come. We are thinking, hospital is thinking from the point of more patients. But because it is connected to their earning. If they're already earning, from the mass pool of money that is given by everyone to keep them in health, will they take the same decision? Will they use some medicine or some therapy which is bound not to be beneficial in many patients? There are a list of chronic diseases which cannot be cured by medicine. The diabetes, medicine, and hypertension, and all this are being managed. They are not being cured. We are managing them with medicine. So people have taken it for granted. Keep your sugar level normal, you are okay. But the disease process is going on inside. The factor which is causing diabetes is still there. Why the diabetes is happening at the first place? Why the insulin resistance is happening in the cell? Diabetes type 2, which is the most common, is because of this cellular resistance to the insulin, which is normally produced inside the cell, not inside our body. And the insulin doesn't act there. And we give medicine to increase this, reduce the resistance and increase the sensitivity of the medicine. That's what medicine does. If the frequency therapy reduces the resistance to the insulin of the cell and they just require normal amount of insulin that is present in our body, it does not require the medicine, and that will lead to the cure. So you must think in this term. And in the future, the disease rate is going to rise such a high, and the amount of doctors and hospitals will be so low in comparison to that, then this therapy will remain our mainstay. If we want the society to remain healthy, because healing not only helps in healing, it prevents also. It tells you the issue much before the disease has set in. So if you gives the indication to you that disease is going to come and it heals you at that stage, the number of diseases which is coming to the hospital and doctor will get less. So the doctor will be able to focus on those diseases that is really curable by medical science, and not giving his time and energy wasting on some diseases which are not curable, and we are loaded with the patients. 200 patients waiting in the OPD, and only 10 or 20 are really requiring medicine which is curable. The rest of them you are just managing. So you are overburdening yourself also. So you must look into the factors that will reduce the incidence of disease in the society and focus on your attention only on diseases that you as a modern medicine can cure. The rest of the diseases let it be taken over by those with an alternative form of healing and pranic healing. But all this what is important is they are not researched, they are not standardized, they are not proven. So we must do to prove them, to standardize them, to get them into the data and analysis, that nobody does false claim that I can heal. Whoever does, they must be subjected to research and cross-checked. Then only alternative therapy can also come into mainstream medicine, and we will refer. We our doctors cannot heal you. We have only this medicine. We have sleeping pills for your sleep, but your sleep will come only when you will be harmony with the environment, your social factor, your family factor, your occupational factor, your every factor must be taken into account. Go to there, and there they will do you. So you must complement each other. Today is competition, no complementation. So you must complete each other, not compete each other. And if you make that society which will complement each other, it will be the best news for the patient, because ultimately it is a patient which is suffering in this confusion. So you must clear that confusion.
Thank you, Doctor. You said so many wonderful things. I hope people will rewind, especially this question, and listen to it again, because I got so many gems from this. Number one is, in my experience, having suffered from Hashimoto's suddenly after COVID, nobody knew what was happening to me. Everything in my body stopped functioning. I got ischemia, my heart, irregular heartbeat. My digestion went, my skin went. I began putting on weight. I couldn't, everything, all the possible things related to thyroid you can imagine. And when I started using Healy, I found out that I have Hashimoto's. And in Western medicine, we all know that there is no cure for Hashimoto's. But you won't be surprised actually. But my TPO levels from 680 after using Healy came down to 240 in 6 months. And even my functional medicine doctor, who now has bought a Healy, she was surprised. She said, this is not possible. Do the test again. So I did it again. The same thing, because Healy is finding out what is the problem much before. So for example, when you said insulin resistance, because of certain stress in my life, because my mother was very, very ill, and because of that stress, I got insulin resistance, and I don't even eat sugar. So we have to understand that insulin resistance is not a sugar, tum sugar khate ho, tum mithai khate ho. It's not about that. It's about stress. So it kept on coming for me, doctor, spleen, pancreas. And I was thinking, like, what is this? I just took the program. Then when I did the analysis again, it clearly showed, because of the bach flower remedies and all, showed because of the stress was causing insulin resistance, and that's why my spleen and pancreas were impacted. So so what you said is so important, that Healy is able to detect, some sort of faulty, thing in the body, which will turn into a disease maybe even 1-2 years before it actually manifests as a cancer or a Hashimoto's. Could I be right in saying that?
Of course, see, the term disease, because people understand it better if I say it this way. Disease is a mixture of two words, is and is. So you get disease only you are in dis-ease for much longer period of time, and Healy detects that dis-ease in you. And the blood test will get disease. It will give you what is the disease. But when the blood test will be normal, when you are in dis-ease, and only Healy can tell you that you are in dis-ease. So if you get that to know, and your confidence in that, whatever Healy tells me is right, I'll get that frequency. You'll be also careful for other factors so that you can not develop that disease which is warning is coming. Suppose some meridian 1 or 2 analysis is coming. In this stage, the gut is a problem. So there's no problem in the gut. I have no pain. Everything is normal. But still it will say the meridian 1 and meridian 2 problem is there. So you will take better care of your gut. You will eat more water. You will take fresh green vegetables. You will eat at right time of day with giving certain vibration in the food. Then you will see that analysis is giving lesser frequency, even without doing healing. So
I've noticed this, because when we do the analysis, it many times it comes up with gut issues for me, but I'm not feeling like I have any pain or bloating. But all autoimmune diseases, I know they affect the gut. So I don't question. And what you said in the beginning is another very important thing that I want to mention. Whenever you take the frequency, like when you go to a healer, when you go to a doctor, you always go in full faith. You won't go to a doctor and then doubt the doctor, अरे सही medicine दिया कि नहीं. Yeah,
Right.
if someone comes to you, they know Dr. P. K. Jha is so and so. So they will not question. They will just give you the money, take the treatment blindly, literally blindly, because they have faith in you. That's the thing we have to do with frequency therapy. It's a frequency. It can't go wrong. See, man can make mistakes. Like I can make a mistake, but the frequency, the way you explained it, there are no mistakes.
So what is happening more important is the frequency which is coming to the server, or rather increasing in number day by day. And the AI is getting more intelligent. That
Yes.
the indication of meaning of this frequency was this, now it is this. So day by day, it is getting more smarter and taking proper decision, better decision to give you back exactly frequency that is most beneficial in you. Because it detects the frequency, gives you the frequency, and again checks you whether the frequency has gone down. Now it will learn, okay, this frequency has worked. Now it will give you others, people also the same frequency without doing anything. It is real-time research and treatment going on automatically. So that is what is happening.
Yeah, absolutely. Because when you look at the device, if people who have a Healy, you can see the frequency changing every 10 seconds. Because, and also we'll note, I've noticed today I was taking a program. Last week when I took the program, I took the entire program for 69 minutes. Today when I took the program, because my body is healing, after 58 minutes, the program stopped. Isn't that beautiful? So it's not giving you too much frequency also, because everything is a balance in the body. So it's harmonizing things really beautifully.
So that in that way it differs from other frequency therapy. People have listened about TENS, trans electric stimulation is given, and there are many frequency, sound therapy, mantras therapy. All therapy are frequency therapy only.
Definitely.
But they are based on single fixed frequency.
Yes.
It is not a dynamic frequency. What Healy is, it checks the need of that frequency and it gives you that frequency only till the body needs it. Then it changes the frequency. So the real-time detection and modification and applications of required frequency. That's what it is differing from other frequency therapy, and hence it is most beneficial.
And that's what they mean when they say IMF, individualized micronized frequency. Because if you're taking a meridian bound program for spleen or pancreas, if I take the same program, the frequency could be very different, right?
Yes, yes.
What it's giving you and me, because it knows your needs and my needs are even for migraine, like you mentioned. Like there's a very famous clinic, Dr. Reddy's, that has a migraine machine, but it's a standard frequency. People who have used that machine have told me it's a standard frequency. It's not a dynamic frequency. Yeah. I have one more question for you, Doctor. You have a new initiative called NeuroCare India, which is your most recent labor of love. What inspired you to create a platform that blends advanced neuroscience with frequency-based healing and different energy healing? You're a certified life coach. And if people go to NeuroCare India, which I encourage them to do, there are so many different energy-based therapies. Frequency therapy is an energy-based therapy. We're talking about Healy. And you also, give people modern medicine via your services as a certified trained doctor. What do you think is your long-term plan? How do you see it transforming wellness in India and maybe even in the world?
See, NeuroCare India is established with the view that no person should suffer from lack of information, because in the neuroscience, it is the information given to you at the right time very important. And I have met the website. People can ask me from anywhere, but I encourage any doctor anywhere can come contact with me and take my franchisee and use their clinic to give the same advice that I give through a software that I've developed automatically. People can just put in the symptoms and what diagnosis and what advice I give, it will come to them also, and they can treat the patient, save their times and money, because the neurons requires time. Nerve is the most metabolic active tissue in the body. Your brain is only 2% of body weight, but it requires 20% of cardiac output every minute. So even if you are sleeping, it requires high blood supply, because the moment the blood supply goes down, you become unconscious, you become dizzy. So time, again, very, very, very important. If the blood supply is going and something has stopped it, either because of stroke or because of head injury or because of some mass or tumor, it is urgent to regain the supply, because the nerves are dying every second. So NeuroCare India is established to save time and money and energy for any person anywhere in the world, and they can connect to us and we can give them either medically needed therapy. So I have a whole branch of this thing. I have kept the possibilities at both ends till the time when medicine can help you, surgery can help you. Just I have come from after removing a clot, I have come into this interview, and I'll go and see my patient there. So I'm not leaving that. Whatever is required in the patient medically or surgically, I am doing. But I'm very clear that in this patient, medicine or surgery has no role. Medicine I still give for just 5 days, 10 days, 15 days. I'm not denying medicine. Those having severe headache and insomnia, they require antidepressant, anti-epileptic, and whatever is required, they are giving. But we have to give permanent cure. And for that, healing is required. The energy has to be supplemented, and restoration of body and energy back to normal is very essential, and that is possible, hence we are doing it. So I'm doing the whole range of counseling and life coaching also, and giving surgery and medicine and giving this healing. So complete range of this whole treatment must be given by all doctors, and I will research about it, I will prove this fact, and I'll tell the authority to bring this alternative medicine in the mainstream medical science, and every doctor who is undergoing MBBS training should know about that what is beyond medicine too, that should be used in practice. Then only your patient will thank you, because they have come to heal. Whatever you do, they will take it. But if you say that I'm a doctor, I do only this. So where is the limitation? If you cannot do it, you keep your assistant who are in alternative healing. But let the alternative healing be proved also. Do it in a standardized way, which gives benefit, and do research on that and come out with the data that I have healed these many patients with this therapy. And that's what in my software is also. I have made the software about quantum healing in my website, that whoever is doing whatever therapy, just enter into that data, what frequency, for how many days, what are the protocols that he used in that particular person, so that we'll have a richness of data, so that any other healer can come and search from there. I have this patient, what are the frequency and what is the duration of therapy in this patient required. So let us help everyone to help the patient in the first place.
Thank you so much, Doctor. One last question. Could you please tell us about the recent presentation that you made to the Cancer Institute in Delhi, and what's the name of the institute and what are the details, if you can share with us?
See, the thing is, I'll not give you the name at present, because let it be finalized first, because the protocol is defined, and we are doing complete analysis how to take sample patients of cancer in whom we can do this heliotherapy, how it supports in patients' complications and reduces the complications while going chemotherapy, radiotherapy, or surgery, and how rapidly it leads to surgical healing. So all this can be researched, and also it is very important for prevention also. In prevention of cancer, this healing is of intense value, because cancer is the result of intense, if bad emotions in you for a long time. People say the cause of cancer is alcohol, smoking, and bad air and everything. I'll say it is not at all. The cause of cancer is not external pollution. The cause of cancer is internal pollution. Internal pollution because of your envy, because of your jealousy, your anger, your frustration, your suppression in the society, and your high ego that not lets you sleep. All this leads to volume of chemicals flooding your whole body, and the cell becomes confused. And the cell, which are destined to proliferate normally, they proliferate in a way that they do not know itself where to go, and that becomes cancer. And heliotherapy can detect that emotional state of a person. There is a resonance therapy, resonance frequency that analyzes your mental and emotional state, and those with bad emotional state and resonance state, the value comes, this is so high. And if we can screen 100 people and get 50% who has bad emotional and mental state, if you do screening in them, the detection rate of cancer will be much high in them. So normally we are doing screening of cancer, we detect 1 or 2% of people who are having cancer. So we are wasting of resources, manpower, and time. People are conducting cancer screening in population. They go and call people and do all these tests. That is causing huge loss of time, resource, and everything. If you just do the emotional analysis, and in 30-40% who have bad emotions, that will Healy will tell you without asking them anything. We can know about their emotional state. If you do cancer screening in them, then your detection rate will increase to at least 5 to 10%. At least. Then we can serve the people and detect the cancer in early stage. So it is very important to use Healy in a scientific way. And cancer is a big opportunity for this frequency therapy. Not only cancer, but also diabetes, heart attack, hypertension, obesity, joint pain, arthritis. All these things are being managed only with medicine. They are no cure. But we must use Healy to heal these peoples. And I'm not telling stop medicine, but it will help you to reduce the dose of medicine, get the complications of the medicine less, and better healing and faster healing in the long run.
Thank you so much, Doctor, for your time. It's been absolutely wonderful, and it's been an honor to have you on this podcast, Align, Attract, Achieve. And I wish you all the best. And I'm sure we'll be associated because I'm very convinced about your, about Neurocare India and about the trials and the measurability that you have taken upon yourself to prove and to provide to people an alternate to healing with lasting results.
I'll tell you one thing also, not prove, also to disprove. Because
Yes.
as doctor, we cannot prove or favor any product because many will ask question, why are you favoring this? I am not only to prove, but also to disprove in the long run. Maybe after 2 years, I'll say, no, it is rubbish. It is of no use. So I'm open to that also. I'm not favoring it. I'm just giving the best option to my patients who require true healing.
Yes, thank you for being so astute and for being so objective and not being biased. I appreciate that. But at the moment, we both believe that Healy can be a miracle for those who are searching for a long-term cure. At the moment, that's both our belief, and that's why we're doing this so that we can help more people. So more power to you for that. And God bless us on this endeavor. And God bless all the people who are open to this beautiful divine gift. Thank you once again, Doctor. And hopefully there'll be a part 2 soon. But I will be listing all your links, your interview on TV. I'll be listing everything in the description under this video on YouTube. And take care of yourself. And it's been an honor from my heart to yours. Atma Namaste.
Thank you.
Thank you.
Thank you.